Hi, I'm Brent Stafford, and welcome to another edition of RegWatch on GFN.TV. We're here in Warsaw, Poland for the Global Forum on Nicotine 2024, and sitting with me is Joe Thompson. How's it going, Joe?
Very well, thank you.
So you are the the Group Science and Regulatory Affairs Director at Imperial Brands.
That's correct.
Let me ask you, and I ask this often to folks in the industry, is that why the grouping of science and regulatory affairs?
Yeah, it's a good question. I think mainly because we're a heavily regulated industry, we're heavily scrutinized, and much of the science we're doing is for compliance reasons. It's to comply with technical product regulation. So it enables us to do that. It enables the science we're going to take, enables us to assess product safety, which is often relative to combustibles. It provides the data that we give to governments and regulators worldwide. I think we report in 53 to 58 countries, providing them with technical data, scientific data on our products. Some of those products need to be approved before sale, proving out harm reduction and engaging with regulators on the science of our products. So the two kind of go hand in hand. So often you'll find the science and regulatory teams very tightly knit, and that's the case for Imperial.
So is your background science, or is it on the regulator side?
Both. So I've been with Imperial for over 20 years. I'm a scientist by training. Physiology, then toxicology, but I've been on both the regulatory and the scientific side for a long time.
Tell me about the challenges that your company faces dealing with the regulators.
Well, let's first start with the consumer, because we serve the consumer, and it's about identifying their needs and creating products for them that they choose. As part of that, you have the scientific data that you generate, and you provide that to regulators. I think some of the challenge is probably for the regulator is, do they trust the data? Do they trust the science? And our part in that is being open, being transparent, ensuring that the science that we provide is peer reviewed. It's open to scrutiny, open to challenge, but certainly that trust, building that trust with regulators is probably the biggest challenge.
In your experience, has the regulator ever looked at the user as a consumer?
No, not in my experience. They tend not to look at them as consumers. In fact, sometimes refer to them as patients.
So they've medicalized it?
They've medicalized it. It's a generalization, not in every market, but certainly that's been an experience, but never referred to as consumers.
So you mentioned it, your NGPs.
Yes.
Tell me about that.
So NGP is a term we use for next generation products, which is non-combustible consumer products that contain nicotine. So we have three main categories, three main brands. We have a heated tobacco product called Pulse. We have a vaping product with the brand's Blue. And we have oral nicotine pouches and the brand's Zone X. Now,
Blue actually has gotten some traction, hasn't it?
Yes, it has. So Blue is probably one of the biggest brands, or vaping brands globally. It's got quite a long history in the US. But we've developed the product. We've had different iterations of devices. And it's now gaining traction. We had a bit of a reset in terms of strategy across NGP maybe 4 years ago, and said, look, these products aren't meeting consumers' needs. We need to look again, develop them further, and then go into markets where there is a genuine demand for them, where the regulation is clear, and where we've got a right to play and a right to win. So there was a bit of humility there and humbling of actually looking at ourselves and looking at what the consumer really needs and begin to develop that. And we've continued that in terms of our innovation and are continually looking across the board for heated and for vaping to say, okay, well, what do we need to change? What's working for consumers? What's not? What's going to help them move from combustible cigarettes to potentially less risky product?
So how important then is tobacco harm reduction for Imperial?
Critically important. We are absolutely committed, right from the PLC board all the way through the organisation, to making a meaningful contribution to harm reduction.
So tobacco control, the critics will always say, well, if they were really serious, they would just stop selling combustible cigarettes.
They would say that, but that's a little bit of a naive view. I think, let's start here. Tobacco should be controlled. Harm reduction is part of tobacco control. And the reality is that all the work that has gone into next generation products and in developing those products and providing them for consumers, for them to choose, is funded by cigarettes. And actually, it's the consumer will ultimately choose. The consumer will choose the cigarette, or the consumer will choose the next generation product. You can have the best product in terms of scientific safety profile, reduced risk product, but if the consumer does not wish to choose it, then you don't have harm reduction.
Joe, what I really love about this conversation is how much you're referring to the user as a consumer. It strikes me that regulators don't see them as consumers.
Right. Public
health, tobacco control, they don't see them as consumers, but yet they are consumers.
They are consumers, and they're adults. They're informed adults, and they will want to make a choice. And that whether a consumer is smoking or using next generation products, they're doing so for moments of enjoyment and pleasure, and it's their choice to make.
Is the vapor product, more popular than, say, the heated tobacco product?
It really depends country by country, or as we refer, market by market. So if you look at the UK, vaping products have proved very popular and have demonstrated some success in terms of harm reduction. You can see the parallel between smoking rates declining at the same time as vaping rates increasing. Other markets such as Greece, Italy, heated tobacco product seems to be the consumer's choice.
One of the questions that I always like, and it's always a tough one, is that how do you handle the use of the term safety?
Yeah, so we tend not to use the term safety. Let's be clear. These products are marketed to adult smokers, and we assess them in terms of their risk, their relative risk to combustible cigarettes. And science is very clear in building confidence that these are substantially less risky than cigarettes. They offer great potential for harm reduction, but we don't have long-term data. We don't have epidemiology data yet. It will come that could make stronger statements than that. So we don't refer to the products as safe or safety.
Do you think that when that data does finally come in, that anybody's going to take it seriously? Because it just seems that science from a tobacco company is exonerated from the conversation.
I think that's the challenge, and that will always be there. Will be always questioned. I think there are two things. All that we can do is be open and transparent with our science, ensure that it's published, open it to peer review, to criticism, to challenge on the one hand. And on the other hand, it's not just the industry that's researching this. So you have academic institutions globally. There's over 100 clinical trials that have been conducted on vaping products that demonstrate relative safety over a 2-year period. So there's a lot of science out there that is not industry generated. Of course, the industry knows its products best, and you would expect, in fact, we've got a common law obligation to be experts in our own products. So the science we do is sound, is solid, but recognize it will always be viewed with some skepticism.
So does the company utilize, value, say, the meta-analysis coming out of Cochrane and, say, the science coming out of University College London?
Yes, absolutely we do. And we monitor all of the scientific and medical literature on a daily basis and assess that and look at that to say, okay, what's that telling us about those products, their safety profile, their risk reduction potential, and we do that across the category as well as looking specifically at our own products.
Your team shared a brochure from Imperial with me, and there was a section in there called the THR equation unpacked. Yes. Tell us about that.
So the tobacco harm reduction equation is really the framework by which you can reduce the demand and supply of combustible cigarettes. And it has a short version and a long version. The short version says this, that you get population harm reduction when you have a product with potential to reduce risk to the individual multiplied by consumers choosing to use the product. The longer version recognizes that there's a bigger piece around consumer acceptance, which talks about the appeal of the product. So the product must appeal to adult consumers, and also addresses unintended consequences. So does the product, and to what extent does it appeal to non-smokers or to youth who we would not want to be using our product? Does it appeal, and does it use them? And therefore that subtracts from the equation. And of course you need the greater good, the greater benefit to harm reduction and population as a whole to vastly outweigh the risks with unintended use.
Yeah, that's tough.
Yeah.
Even on just the pure vaping side, the industry is struggling a lot with the fact that now, some decade and a half, coming up 2 decades later, there are, young adults who never smoked who are choosing to use nicotine vaping products. And that's causing a massive concern. We're talking adults, people of majority age, choosing to use these products. And somehow, to the critics, that doesn't feel right because it's a new generation of users.
Yeah.
Do you have any thoughts on that?
Yeah, I think certainly from Imperial's perspective, we're marketing only to adult smokers, sure. adult vapers. But yes, we recognise that there is a number of non-smokers or never smokers that are choosing to use nicotine-containing products. What does that tell me? It tells me that there is demand for that. We'll see what society says about that demand. I think
it's a sticky wicket, isn't it?
Yeah. Well, I think time will tell, and we'll see what society says about that. But a lot of the issue and the concern comes from, frankly, the misperceptions around nicotine, which is, the misperception is, well, nicotine equals tobacco, therefore equals disease, therefore nicotine must equal disease. And it's a complete misunderstanding of the safety profile of nicotine, and it misunderstands that actually it's the components within cigarette smoke are the problem, not the nicotine.
Should the conversation be switched to recreational nicotine?
I think as I said before, I think it's probably a question for society in time. We're marketing to adult smokers.
Well, I bring that up only because nicotine is already legal in most places recreationally. In a cigarette.
It is.
Yeah.
Yeah.
So it seems to me tobacco control in some places are, recreational nicotine's okay as long as you use it in a cigarette.
You'd have to ask them what their thinking is around that.
Joe, you mentioned that there was a bit of a humbling moment for the company over the last couple of years, just in terms of your approach. I noticed that in the brochure, which was, there was kind of a mention that we're not the biggest guy on the block, and to take that into account with the planning. How is that?
Yeah, absolutely. So we're trying to really ensure that we have good consumer insights and really understand our consumers and the consumers that we're trying to meet their needs, and then doing that in a targeted way, both in how we innovate and how we develop products, but then also which markets we go to and where we pilot, and then get feedback and feedback from consumers before taking decisions on do we roll products out to other markets.
What can you tell us about the experience in the US? Can you address anything there? I mean, it's a bit of a quagmire, right?
I think certainly, in the United States, they've set out a framework. They've set out a framework which allows for regulatory oversight, approval of products that are deemed appropriate for the protection of public health, and potentially to be marketed with the right authorization as reduced risk. I think the reality has been very difficult, and many companies have spent millions of pounds, millions of dollars, trying to pass the standard, pass the test, without. It's like taking an exam, but you don't really know what the syllabus is or the pass mark. It's I think looking from the UK across, it seems a bit of a mess, and further confused by the FDA approving a combustible cigarette as a modified risk tobacco product, which seems very odd to me. There is a combustible cigarette which has a lower level of nicotine that has been...
Century 21 or Century...
I believe 21st Century, I believe, was the company. But the FDA deemed that that's a modified risk tobacco product, and yet vaping products with potential to reduce risk have been denied or under lengthy scientific review.
Well, in the last couple of years, while they refused to really, grant marketing orders for vapor products, they have approved 1,200 new combustible cigarettes.
It's a lot.
Yeah. So under the SE, the
substantial equivalence.
Yeah. So, but that's still putting 1,200 cigarettes on the market.
It is.
So FDA Commissioner Robert Califf, in an appearance before the House Oversight Committee back in early May, maybe late April, he was asked multiple times about tobacco harm reduction and whether or not the FDA believes in tobacco harm reduction. And not only does it appear like they don't believe it, his answer over and over and over again was that THR is an industry term. He referred to it as that.
I think that's astonishing, frankly, and I think that those involved in harm reduction would be appalled, because there are many that they're not supporters of the tobacco industry, but they have great belief in harm reduction. So I think they'd be appalled by that. And in fact, maybe he needs to speak to his own advisors, because I think harm reduction goes back certainly 1994. Neil Benowitz, Jack Henningfield, both respected scientists in their fields, termed the harm reduction. Institute of Medicine, Clearing the Smoke publication in 2001 sets out a framework for tobacco harm reduction, sets out the reasons why, uses analogy from other harm reduction programs, and sets out, well, this is how you would do it scientifically. So it's not an industry invention. Would love to take credit for it, but can't take credit for that.
Yeah, it sounds like to me that just because the industry is starting to use it, they're saying that they're denigrating it, right? They're saying, well, the tobacco industry is not a valid participant in tobacco harm reduction. I guess that's what they're saying.
Which is, I think, crazy. There's over 1 billion smokers out there. There's a billion people on their own journeys. And we have a role in understanding those consumer needs and providing them with choice. And part of that choice is products that have the potential to reduce their own risks.
So when you look around here in Warsaw at the Global Forum on Nicotine, why is an event like this important?
Why is it important?
Yes.
I think because the industry is part of the solution. And it's important for us to understand different views and different perspectives, and to be humble about that and to learn. So that's why we're here. We've got a contribution to make, but actually we want to listen, we want to learn, we want to understand the views of stakeholders, what the challenges are, what the barriers are to harm reduction, and identify what our role is in supporting it.
So as a question I ask anybody who, works in the tobacco industry, and it's the last couple of years I've asked this question, is that like, do you kind of feel like you've been pinched? Like there's no room for redemption? Because here you are trying to put forward something that is much safer than the combustible tobacco, and yet you're getting raked over the coals.
I don't think we look at it as in terms of redemption at all. I think we look at it in terms of consumer and what's the consumer's need there, and how do we meet those needs, and how do you do that responsibly with cigarettes, but how do you offer them products whereby they can control their own risk, reduce their own risks of disease, and understand the drivers and the barriers to help them shift to potentially less risky products.
How important is it for the industry to demonstrate commitment to tobacco harm reduction? To demonstrate it?
I think it's very important. I think it's what to ourselves as an employee of the company, it's what we expect of each other, and certainly to shareholders, to investors, it's what's expected. It's our public commitment, and that's what we're working towards, to make a real impact on harm reduction through our next generation products, and that includes being able to demonstrate that in market. So we've as part of our ongoing monitoring of the science, we've recently conducted what we term actual use studies, which is to give smokers with no intention, or to monitor smokers with no intention of quitting smoking, use of our NGPs over a 6-week and then a 24-week period, to see, well, do they work for you? Does it help you reduce your smoking? Did it help you quit smoking? And that's all important evidence points to say, okay, well, you can have the science in the laboratory, you can have the science in the clinic, but actually, are consumers using them, and does it help them on their journey to reduce combustible cigarettes?
Are you witnessing any of the phenomenon that's called accidental quitting?
I'm a victim of accidental quitting, so yes.
Oh, do tell.
Yeah, so I was a smoker and occasionally vaped, but none of the products really, I only vaped Imperial's products, but didn't really do anything to help. And then we had a product called My Blue, and which actually is the product that's available, I think, in the US. And I gradually was vaping more and smoking less, and now I don't smoke at all, and I vape occasionally.
Congratulations.
Yeah.
You mentioned shareholders. How important is it to demonstrate that your commitment to tobacco harm reduction to actual shareholders and key stakeholders?
Yeah, there's an expectation that we will do that. It's part of our ESG strategy. They certainly ask us questions. Analysts ask us questions. So there is an expectation there. But there's a head part to it, and there's a heart part to it. And the heart part is, but it's the right thing to do.